and of course, moving down the coast a little bit to the Bay Area and Southern California. But then New York really came on strong a couple of weeks ago. And of course, that is the hot spot. They are peaking right now, it appears, in New York. But then the virus is really coming into the middle part of the country as well. So with hotspots in Detroit, New Orleans, both, northern Midwest and the deep South. So Indianapolis has been mentioned as a potential hotspot. So, the virus moves around with people. Now, fortunately, the city, the country has been much better in terms of locking down movement and social isolation in these past couple of weeks. So that is the key to denying the virus, right? Is staying 6 feet away from each other, only moving outside when you need to, especially when you're going to be around people like at the grocery store. So the more we do that, the more successful we're going to be. Now we know the positive test results are going to continue to increase because testing more people. We'll talk about that in our call here today, but we'll also maybe talk about other ways that we can measure how widespread the disease is, because we know there's a lot more people that have the virus than are being tested. And we're learning a lot more about people that have no symptoms, that are asymptomatic, that are carriers. We can talk about that in the call as well. As it relates to Louisville, in our data, as of yesterday, we had 372 confirmed COVID-19 cases. That was the biggest single day increase we've had so far, 59 people. And as I said, that's not surprising. And it's really, we say 372 confirmed. I'm sure there's at least a zero on the back of that, is in 3,720, or maybe another zero in terms of 37,000 people carrying the virus, because we're just not testing everybody right now. Now, sadly, as a community, we've lost 23 people so far to COVID-19. These folks have all been in that highest risk category that we continue to talk about. So people with underlying conditions, they might have diabetes, heart problems, have some kind of suppressed immune system. It makes them more susceptible to the virus. The virus, attacks people like that, and they have a much higher mortality rate. It's in the neighborhood of 15% or so. So this is why, even if you're young and healthy, and you think, well, you can get this virus and get through it, you probably will, although there's higher rates of hospitalization now with younger people. But what you also will is when you're around your grandmother or your great uncle, you can pass the virus to them. And if they're in these vulnerable categories, they are in deep trouble. So that's why we ask everybody to really take personally this issue on social distancing. Also want to talk about the additional guidance that we've been giving over the last 3 days. If you're out in public and you're going to be around people, let's say at the grocery store, wear a face covering, put on a mask. And the purpose of that is, one, is a sign of courtesy on your behalf and compassion on your behalf. But the science behind that is, if you are a carrier and you don't know about it, that mask will protect somewhat other people that are around you in terms of you breathing, sneezing, coughing on them, passing droplets in any type of way. So please, we ask everybody to put a mask on when you go out in public. Do not think that means that you can get within 6 feet of people. It's just an additional measure of protection as we try to deny the virus. We're doing a good job as a city. I'm proud of our city. I'm grateful for everybody, the good work that they're doing here. For the most part, we're getting 99% compliance, which is good and a lot better than most cities. And we started earlier. That's why we've been relatively calm so far. But that can change really quickly if we have irresponsible behavior and we have a mass spreader out there. So everybody, we're going to have to really hunker down here for a while to keep this virus in track as we move through this health crisis we're in right now. So with that, let's go over to our guest here today, Dr. Klein. Welcome back. And Dr. Taylor, thank you so much for joining us. Let me just throw it to Dr. Klein first. And since our last calls, John, kind of what are the observations in terms of what you're seeing locally? And then we'll go to Dr. Taylor and ask her for some global observations.
I think that you can feel in the hospitals that the pace has picked up. And by that, I mean that everyone in the hospital is being rearranged into different teams that allow us to focus either on COVID positive patients or not. The amount of personal protective equipment is holding out, but we haven't seen a surge yet. We keep thinking that it's coming this week, next week, the week after, but we know it's coming one way or another, and that the hospital systems are going to be tested. I'm kind of impressed by the amount of cooperation across the hospital systems. It's exactly what you would want to see. And so I think for the most part, these are positive things. That said, we're seeing more cases, and we know that that's going to happen. We know more people will test positive, and that the system will be stressed at some point in the near future.
Why do you think we haven't seen a peak so far? I mean, what's going on now? We're seeing it in New York. Why aren't we seeing it here?
I would love to think it's because we're doing so many things right, and I think that's part of it. And so everyone should continue their social distancing. And for the most part, what I've seen are people are paying attention to this, and they're being polite about it and considerate. But I think there's another advantage to that cities like Louisville have, and that is that we just have a lower population density. If you go to Brooklyn or if you go to Manhattan, people are living in very large buildings and they're at close quarters. I think it's just much easier for the virus to spread in high density populations. And that's why we've seen mostly the real hotspots have been in high density areas. So I think we're blessed with the fact that there's a lot of land in this county and people are living for the most part in more social separation just in their living quarters. That said, that also means we have to be very vigilant at the most vulnerable people, or regarding the most vulnerable people in Louisville, who don't live in a more scattered sort of housing situation. So people in nursing homes in particular, or people who are in public housing. So the elderly in particular are tremendously vulnerable.
Switch over to Dr. Mona Lisa Taylor. Dr. Klein mentioned density as an issue in terms of the virus being able to spread more easily. But also, when you look at Seattle, they had lots of traffic going back and forth from China to Seattle. Of course, China was the origin of the virus. And then likewise, New York City is a global destination. So you got a lot of global travel coming through there. The virus was traveling with them. And then of course, you really don't know about it until a week, 10 days later. And that's when you see this massive spread going up and down the East Coast. So, Dr. Taylor, what are you seeing in terms of national activity with the virus? What can we learn from global activity? And then we'll get into the questions that are coming in right now. Mona Lisa Taylor.
Well, it's a great question, Mr. Mayor. I know from our experience in Italy, we've seen what happens when you don't close things down quickly, and the hospitals get overwhelmed. And we've seen that a lot in terms of the Italy experience. And then we started seeing that as well in New York, with field hospitals going up in Central Park, and a lot of patients filling those spaces and trying to take care of all those patients. And of course, resources have become an issue. So New York is a good example of what we don't want to become around here. In terms of other places around the country, I'm familiar with Boston and Washington, D.C., since I have friends that are physicians there as well. And my friend in Boston told me that half of their ICU team now are just corona patients. The other half are the other patients there for the typical usual reasons for being in the ICU. We're not to that point yet, but that's kind of what our future may look like, in that we're going to have a lot of corona patients on one side of the hospital and a lot of non-corona patients on the other side of the hospital.
Right. I know my wife is a physician, and yesterday was her first day back. Told me that the way the hospitals are segmenting traffic is very clear right now in terms of corona patients going one way and others going another way, and that type of strict segregation. Is that what you're seeing around the city?
Well, I am.
Been the move.
Some hospitals have divided into so-called hot and cold zones, where the hot zone is for the COVID patients and the cold zone is for those who have tested negative. And also in teaching hospitals, we're seeing sort of a separation into teams where there's a COVID team that's responsible for admitting those who have clear symptoms and who are awaiting the results of their test. If their test is negative, they move into the cold area of the hospital. And so we're all sort of adapting the processes within hospitals that we grew up with. They're very different, but the good news is that people are adapting very quickly to these changes.
Got a question here from Katie O'Toole. Some people have gone to the hospital and been told that they probably have the virus and are sent home to quarantine, but were not tested because of lack of tests available. Are they still counted in the numbers? I would say no, they will not be counted because they didn't have a test, so they're not a positive. Now, but there's a term that people are starting to learn more about: patients under investigation. So, Dr. Taylor, would that person be a patient under investigation or a PUI, or how would a hospital track somebody like this?
We've got CDC forms to list people as persons under investigation. If they are having symptoms that seem consistent, you've got some lab work or like imaging, because that's another spot that we can see the virus very well is on a CT of the chest, depending on how sick the patient is. You could always fill out one of those forms for a patient like that. Unfortunately, the testing has been very strict because of the fact that we are running out of swabs and the reagents to actually run the testing. So they've tried to reserve it for the people that are very sick and in the hospital.
There's a testing question here from Leslie Burton on why is there such a discrepancy with what the governor reported yesterday? The total for the state was 50s, but Louisville alone had 50 plus new cases. I'll just say the testing information is coming in at different times to the governor and the city on when we're reporting. So there's going to be some discrepancy along here. But let's talk about testing a little bit more. And I'll throw it back to you, Dr. Klein, on we've seen a lot more testing in some other states that have been more the hot spots. And is that because they've gotten tests from the federal government, so they have more volume? And where do we want to be going with tests? So maybe you guys can talk back and forth on, do we eventually want to test everybody, and why is that? So what's the current state of testing, and where do we want to go? So Dr. Klein, if you kick us off on that.
So testing is still limited. And so in Jefferson County, we're applying it to sick patients in the hospital and healthcare workers, doctors, nurses, respiratory therapists who have been exposed to the virus. In addition to that, first responders get tested because they have to get back to their job. And we just can't put, like in New York, 20% of the police department is currently in isolation. So testing's limited. We give testing to people who need it as opposed to everyone who wants it. And we all want it. We all want that reassurance. And that's only human. As testing has ramped up, the restrictions are beginning to loosen up a little bit as well. We've done about 18,000 tests in the state of Kentucky, and most of those, as you might expect, have been negative. It's about 20% positive rate statewide. In Jefferson County, it's a little lower. In fact, it's a good bit lower, not because we have less COVID virus, but because a lot of the backlog tests from early on in the pandemic are pushing through the system and coming out. So what are the real limiting steps? It's simple stuff. It's not science. It's logistics. The swabs that are placed up your nose are in incredibly short supply at the moment. And so at the university, we're trying to manufacture swabs using a variety of processes, including 3D printing over in the Speed School. They're still working on that. It's tricky, and hopefully they're getting closer. We're beginning to adapt other types of swabs. So it's hard to imagine, but right now, the most limiting thing we have is a lack of swabs to take the test, not the fancy equipment to do the high-tech test. We're ready to do a lot more of those once we can find the correct type of swabs, and then the fluid that the swab tip goes in after the test is done.
Mhm. And Dr. Taylor, we're hearing about the advantage or the desire to have basically universal testing. Why is that important?
Well, in terms of universal testing, something like antibody testing to see if you've had an acute infection, which means it was something quick in onset, and then something that gave you longer term immunity. That's going to be important to kind of get us back into our normal life, if you will. Because if you've had the infection and then we find in your blood that you have immunity to the virus, hey, you can get back to work. You're not going to be asymptomatic and spreading this anywhere else. Unfortunately, this is still taking some time since that test just came around recently in the last few weeks. So it's still going to take us a little bit more time to kind of get that more widespread around here.
Mhm. And what is this phrase herd immunity that's moving around? Is this how we beat the virus with herd immunity and vaccines?
It's the most likely way that we eventually um, beat the virus. It's so if we have a group of about 100 people and 85% of them have had the infection and are recovered, they then, because they interact with the remaining 15 people in the group, they are not at risk of spreading the virus. Just, in its most straightforward way. So as we get towards that 85 to 90% infection rate, the chance that people will be able to spread it, uh, it begins to fall. That's the same principle with influenza every year. Is that if we can get 85 to 90% of the people vaccinated, well, the remainder may be able to get infected, but they can't spread it throughout the society. The problem in this particular virus is we don't know what percentage of people have natural immunity because we don't know how many have actually cleared their infection. So one of the things that a really good team at U of L is working on is antibody testing. And antibody testing is a little bit of science here. Antibody testing comes in two flavors. There's if you just have an antibody, we can measure that, and that test is up and running and in the laboratory at U of L. But you have to know if those antibodies can kill the virus. It's not enough just to have an antibody. You have to have what's called a neutralizing antibody. And so now at the Center for Predictive Medicine at U of L, which deals with all these nasty viruses and is set up to deal with them, they have developed a neutralizing antibody test so that we can tell not only does someone have an antibody, but is it an effective antibody? And so that test is being scaled up right now. And that's going to be a really important test as we move forward through the summer and into the autumn to try and identify people who may have protective immunity.
All right, let's go to some of our Facebook questions here, Dr. Taylor. Let's do some. Do you need to wear a mask when getting curbside service or drive-through? What would you recommend there?
It's not a bad idea. I would actually recommend more of a cloth mask or a bandana or a scarf that you're wearing if you're out in public, just so that way you can help prevent the spread of your own germs or picking them up from someone else. And the reason why I'm mentioning cloth masks or scarves or bandanas, we need as much PPE, so personal protective equipment for our healthcare workers and our frontline individuals. So if you can use something like a cloth mask, scarf, or bandana, that would be most beneficial out in public.
Wrong with it. Joseph Payette asked, I have 3D printers. Should I be printing to help the community?
Swabs, and more swabs. And there is no online source of a recipe for people with 3D printers. But I will reach out and contact this individual and connect them with the speed school where they're already developing the recipes of the plastic that's used to make the swabs. And that is a incredibly generous offer.
Gerald Cavender says, what percentage of the city that it passed because of the virus have prior health problems? to our knowledge, it's been 100% at this point. You might want to talk about what the vulnerabilities are people that have pre-existing conditions and why the virus is so much deadly on those folks. Want to start with that, Dr. Taylor?
I think one thing that they've noticed about this virus in particular is that rather than a propensity for symptoms up here, it's causing symptoms in your lungs. And so there were some reports initially that this actually reduced your lung function by 15% or so, even after you had had the virus. Now, if you're healthy and don't have any other medical conditions, you're going to be able to recover from that and probably not notice. For those individuals who might be smokers, they might have asthma, COPD. That's going to be harder to try to recover and heal from this. And so those are the individuals that are more at risk of complications from a virus such as this one.
Vaping. If you're a vapor, is that a good idea?
Not a good idea either, since that's also going to affect your lungs' abilities to actually heal themselves. And so the vaping would be one insult, and then the virus would be a second insult on top of that. So if you are vaping, I would recommend stopping that so that way your lungs can actually help protect themselves.
Mhm. Klein, Stacy Willis asked, what does treatment look like at home and what does it look like at the hospital? And she'd like to know what treatment plans are given to patients admitted to the hospital. So this is an interesting question, right? Some people say, okay, you got symptoms, but you can just go home and it looks like you can get through it. So what's the difference between staying home and working through this and going to the hospital?
Well, regarding people staying at home, you're probably better qualified than I am to answer that question. But
Well, as a caregiver, yes.
yes, yeah, as a caregiver,
From a distance.
as an enthusiastic caregiver, the when people are sent home with symptoms, what you have at your disposal are the same things as if you were staying home with influenza. You need to stay hydrated. You need to control your fever. We're strongly recommending that people avoid ibuprofen and other non-steroidal type drugs and focus on the fever control with their uh, with acetaminophen and also the most commonly known as Tylenol. So staying hydrated, control your fever, um, good nutrition, and then sweat this thing out. And there are a lot of people who can do that. It is described as a mild case of COVID-19. I have not heard from too many people that this is a mild illness. It is unpleasant. The muscle aches, the spiking fevers, and the breathlessness are really disturbing. But at that point, you don't need to be in a hospital. That can be managed in your home, and that way you're not a threat to your friends and your neighbors. Once you're admitted to the hospital, it's just a progression, if the disease gets worse, of good management in terms of, once again, keeping the patient hydrated, making sure they have enough oxygen. And if they have other secondary infections that are bacterial, treating those bacterial infections. We're not seeing a lot of those, but they do occur. As far as treating the disease itself, that's extremely controversial. There are some treatments that are being geared up here in Louisville that involve the giving of plasma from people who have cleared the virus, so it has those good antibodies in it. And that's being done around the country. Here, it's done in cooperation with the Red Cross, and we should be ready to do that in the very near future. There is a lot of talk about hydroxychloroquine and chloroquine. I have to tell you that the scientific reports are almost evenly balanced between it has a moderate effect in favor and it has a moderate effect and not in favor. Those drugs are not harmless drugs, and they are used very commonly in people with lupus and other autoimmune diseases. Those people are also getting COVID-19. So there's not a lot of evidence that hydroxychloroquine and chloroquine are protected. So those drugs may be given to family members who are in the hospital simply because there are reports that they have helped, but there is no clear consensus in the scientific community about the use of those drugs.
So I'm Mayor Greg Fischer here on our Facebook chat with Dr. John Klein, a PhD in immunology and bystander research at the University of Louisville Medical School, and Dr. Mona Lisa Taylor, incoming president of Greater Louisville Medical Society and an internist with the Norton Healthcare System. So please send us your questions over Facebook. And one of the things we talked about a couple of days ago was the importance of maintaining strong mental health, and the importance of kind of having a routine throughout the day because our lives have changed so much. So for those out there that are listening, if you have a routine that you're doing to kind of manage your day and how that's helping you, please share your routines with us. And we'll talk about that here in a moment as we get through some more of these health questions here. Dr. Taylor, we've got a question in from one of our outstanding Metro Council people, Barbara Sexton Smith, and she's asking, what information do we have about the operation of the virus inside our bodies? Does one-time exposure have the same intensity as long-time exposure?
Great question. Hi, Councilwoman Smith. I think we're still learning a lot more about how this virus operates. One of the articles that I was looking at earlier this week was talking about how possibly the amount of virus you get exposed to actually affects how bad and severe your disease is. And so that was one of the reasons they were pointing to why a lot of frontline nurses, healthcare workers, physicians, respiratory therapists were being affected more from this infection because of how much of the virus they were exposed to. In terms of the lay public, I don't know if that makes much of a difference in terms of what you may be exposed to there. I think we're still learning more about that. And one of the other questions that has come up, and I think China has been looking at this as well, is to see if someone who had an infection previously can then get the infection again. And we're not sure yet. This is a virus that has made its way around the world in about 4 months. So we're all learning on the fly, if you will.
Then there's this, you're hearing about cooking the virus. So Glenna Phillips asked, I have read that if you get a fever, that it is somewhat good to keep it at 100 to 102 degrees as it kills the virus. Is there any truth to that?
I'll take that one. There's no scientific evidence. There are no studies that confirm that letting your fever stay high will shorten the course of this infection. If you do that, you run the risk also of becoming dehydrated, because as we all know, the higher the fever, the more water your body gives up. Dehydration weakens you. It makes it harder for you to cough and clear your secretions. If you're older, it can cause you to be confused. So I don't think this is particularly a good idea to follow.
You mentioned a moment ago, Dr. Klein, about ibuprofen. We have a question here. My husband, 65, was switched from naproxen to ibuprofen 2 years ago by his doctor for heart and diabetes reasons. I heard something in the beginning of the pandemic about possible negative effects of ibuprofen, but have not heard anything since. Do we have definitive information on ibuprofen and COVID-19?
You know, we really don't have definitive information. It's one of these strange stories that, you know, at first it was sort of on social media, and I've said before, I got a text from my daughter saying, it says young people shouldn't take ibuprofen because they get, you know, much worse disease. And sure enough, the next day in France, the head of their health department, or the head of their health ministry, said, okay, nobody take ibuprofen and similar drugs. And then 3 or 4 days later, the World Health Organization issued a caution. There really isn't conclusive evidence that these drugs make the disease worse, but there are enough reports from around the world that it just sort of makes sense for physicians to advise their patients that, at least for the control of their fever, once they become ill, it certainly is better to take Tylenol or acetaminophen. If someone is chronically on a nonsteroidal drug for their arthritis, they have to sort of make a judgment there. Is what can they do as far as limiting the amount they take or switching to another medicine? And that's something you should do only in consultation with your prescribing doctor.
Dr. Taylor, some people don't have doctors, right? I mean, very infrequent interaction with the healthcare system. So if you're one of those folks and you feel like this is coming on, what should you do?
That's a great question. We have a lot of really good options now in terms of telehealth, where you're able to use the electronic care through like My Norton chart, or Baptist Healthcare is also offering something similar. U of L may be offering something along those lines as well, just to help screen patients' symptoms and help provide them advice on what to do if they have the corona infection. Um, Insurance companies may also offer something similar, if you have access to that, where you can have that kind of televisit in that sense as well.
What if you don't have a interaction with Norton or Baptist? What do I do?
Uh, you could always go to an urgent care center. That would be fine. So that way they could provide you some information and advice and hopefully help hook you into a physician over the long term as well.
And from a cost standpoint, the state and federal government, there's no cost with being assessed for COVID. That's the government will cover all that. So if you're saying, I just don't have the money to get this checked out, that is not a consideration that you need to be worried about here in taking care of this virus. Okay. So not only is that the right moral thing to do in my question, but think about it from the government's perspective is if you have the virus, we want you to be containing it, right? We want you to be going under the proper treatment because if you're out and about, you're spreading the virus. So there's good health reasons, there's good social reasons for everybody. We want to make sure that we're containing this as much as we possibly can. So, Dr. Klein, we talked about mental health a week or so ago on one of the Doctor is in sessions. What any other thoughts that you've had since then about the importance of keeping a routine or good mental health during these times?
I think about that every day. I really do. I think that in our lifetimes, at least, people my age, we've never encountered anything like this. Maybe our World War II generation was tested in this sort of way, but nothing's disrupted our lives like this. And so for a lot of us who aren't working, aren't going through their routine, who are social distancing and trying very hard to stay home, this becomes even more stressful emotionally. Um, One of the things you may have noticed, everyone may have noticed, is the pace of events is so rapid that we'll say, I find myself doing, and a number of my patients will do the same thing, is say, you know, that thing that happened, that was something, and it was just yesterday, and what turns out it was actually 10 days ago. Our sense of time and how things move is getting distorted for a lot of people in society. So what I try to do is exercise as often as possible. I think that has this ability to settle your mind and improve your mood. I think it's possible to get outside and still practice social distancing. So I'm trying to get out and walk with my wife as often as possible. I'm focused on good nutrition. And then when I go out in crowds, I'm always focused on the social distancing aspects that we've all talked about. A little bit of unplug time, and this is kind of funny to say this while we're on the internet doing a Facebook Live, but a little bit of unplugging from our electronics goes a long way. So what I'm trying to do is for about an hour a day to turn everything off that's electronic and not be bombarded with news or with Zoom phone calls or with all the various things that connect us to the internet. Those things tend to hype us up, and people may have noticed that there's trouble sleeping you need to be focused on trying to unplug, particularly before you go to bed, so that you improve what they call your sleep hygiene, which is just a fancy way to say that you sleep through the night and you sleep better. Those are things that people are encountering as part of the stress and sort of the emotional stress of these extraordinary times.
Dr. Taylor, I think, one of the things totally understandable, and, we're going to get through this. We don't know when. We know we're one day closer to it right now, and there really are amazing acts of kindness and compassion taking place as well. So talk about how, mental health challenges, feeling of depression, are normal. And if you can kind of embrace it as being normal, does that kind of help you get through it in any way?
Think so. And you brought up a great point. Like thinking back 1 month ago, we weren't doing all of this. Our lives have changed a lot in just 1 month. And so it's normal to feel some depression, some anxiety from the number of changes that we have made to our lives in this time. So it's okay to embrace that. And it's okay to acknowledge that that's part of what's going on at this moment. Now, that doesn't mean that you have to wallow in it. You can still do good things to help how you're feeling. And I second a lot of the things that Dr. Klein was saying, like giving yourself that screen time break. I've had this conversation with a lot of friends that it's okay to take a break from hearing about the news or social media or whatever. Take an hour and go for a walk. Make sure you're maintaining your social distancing. Get some exercise just to help refresh your mind as well. That's very important. And as we're spending more times in our homes where we're working, we might be teaching children, we're also doing all of our home activities. Maintaining some sort of time frame that you're going to be working or teaching or doing those home activities so that way you can continue to have a regular day, keep up some sort of routine, but that way you're not working late into the night, you're not teaching late into the night, you're not doing home activities later into the night too. So the routine, I think, for us as human beings is very helpful.
Yeah. Yes, for anybody watching right now, if you want to share your routine, what's your day look like? How do you move through the day? We created something at Metro Government called Lift Up Lou. And the whole point of Lift Up Lou was to kind of help you with some structure during the day, where we start with some exercise and then education, arts, mindfulness at 7 o'clock at night to help you if you want to use that to be construct part of your routine. So you can go to liftuplou.com and figure that out. So, Dr. Taylor, what's your routine?
So my routine's kind of interesting at the moment. With Norton Healthcare, we went to a team A and team B setup. So that way, half of our physicians and half of our staff in the outpatient clinic setting are home 1 week and then in the clinic the next week. So this week, I'm in the office seeing patients between 8 to 5, and then usually trying to de stress when I come home. Uh, on the week that I was working from home, I was making sure that I was checking on my patients, whether that was for messages, refills, um, telephone or video visits like this. So I was trying to maintain that same 8 to 5 schedule where I would be working from home and then still having that de stress routine at the end of the day, have dinner, just wind down um, towards the evening.
And Dr. Klein, what's your routine?
Well, this week and last week I've been rounding in the hospital, and so I go in and make rounds. I'm a kidney specialist, so I see people with kidney failure, dialysis patients, and then when that work is done, I head back down to the medical center, and I've been part of a group that is trying to accelerate our testing process for both the virus as well as antibodies. So that keeps me busy. And then once I get home, my wife and I have tried to go for a walk, usually a couple miles in the neighborhoods nearby. Then we eat a dinner and perhaps watch something totally mindless on television. And then we read books just to sort of separate from the electronics for a while.
Very good. Very good. Got a couple questions here. One from Beverly. I want to assist with making masks. Can you direct me to a site that makes quality and proper fitting homemade masks? I believe the CDC has some guidance on making masks. So you can go to cdc.com. I guess it would be your Center for Disease
.gov.
Control. It's just yeah, cdc.gov. Either of you guys do you have any secrets or tips for masks these days, face coverings?
I know on Norton Healthcare's website, they have listed out some instructions on how to make a good quality homemade mask, along with some links to some design patterns that might be useful. And that's off of Norton Healthcare's webpage.
Do you think we'll be having like mask fashion? Is that going to become a thing?
That's the benefit of cloth masks, in my opinion. They are a whole lot more stylish than the surgical masks or the N95s.
No question about that. Okay. Andy writes in, I have several neighbors who refuse to conform to the recommendations. Is there anything I can do? Yes, I'd recommend one. I mean, if they're friends, you can have a friendly conversation. If they're not, I would not suggest that you engage them. You can call 311. That's where we're asking people to call in and report nonconformance, whether it's in a business setting or a neighborly setting like this. So we can either be in touch with the folks or send them a note just to remind them of why we're suggesting what we are suggesting or requiring and what their responsibility is. But tread cautiously on that. It's interesting. I get comments or notes from people that are out in the public, and when some people are kind of getting in their personal bubble of space, they say, "Can you give me a little more space?" Most people are now habituating to that very quickly. I mean, it is amazing how rapidly we've changed as people to this new environment. So I would kind of assess your situation before you engage directly with anybody on that. And if you have to, sometimes just walk away. I was on a bike ride the other day, and there were two guys that were about ready to get into it, and one of them just said, "It's not worth it." And he just walked away. Okay, that was the manly thing to do. Okay, guys in particular get all jacked up with their testosterone. It's like, come on, man. Be an adult, walk away. So let's see, Dr. Klein. I know you're doing lots of research. That's been a big part of your career. Your dad, bless his soul, he did science up into his late 80s or early 90s, didn't he? So I mean, this has been a big part of your life. And
Yeah.
what data have you seen lately that strikes you as particularly interesting or concerning or surprising?
Well, first I have to say, Dad is 95 and still around. And yesterday was wanting to talk to me about how to make better swabs. He has some ideas, and he's very isolated in his house, and so he's actually in the game. He wants to think about better plastics that can be used to make the swabs, because that was what his
Not
was.
surprised me one bit.
Nope, no. And I will get a call later today about that. I can promise you. What is the surprising science? Well, first thing is something I say every time that we do this is that the rate that science is being produced right now is unlike anything I've ever seen. So that's the good news, is that there's a tremendous amount of work being done. I'd say when it comes to COVID, the two things that stick out about the science. The first thing is that it's our assessment of who gets this disease is changing constantly. So when it was just a disease in China in one province for the most part, we were completely of the impression that this was a disease of very old people who had underlying illnesses. As it spread out around the world, that's still the majority of the cases, but we're starting to see that young, healthy people can get this disease. It may be, like Dr. Taylor said, that they get a big dose of the virus because they're exposed. But there are people who are not in the healthcare system who are getting this. So there may be genetic differences that make you more or less susceptible. And that's something that we're very interested in. And there's a group that's gearing up at the university to study that. The second thing that I think is really important about the science is we're going to have to be very patient. It's moving quickly, but the bottom line is that making a new vaccine, even at this warp speed that we're going through right now, is not going to be done by July. It's not going to be done by August. We have 2 vaccines, at least that I know of, that are currently in clinical trials. One of them skipped over animal studies and went directly into humans. That was the first that began trials. But even those, if they begin to show positive effects, probably won't be rolled out for the rest of us for at least another 6 to 18 months. So science is moving very quickly, but not at the pace we're used to in terms of problems being resolved. So those are the 2 things that sort of surprised me and interest me about science.
Mhm. Then, Dr. Taylor, some people are talking about maybe new therapeutics that can help, I guess, mitigate the suffering, or what's a therapeutic and how's that involved in all this?
So in terms of therapeutics, a lot of it's still experimental. We're trying out different things. These antivirals that were previously created to help with like Ebola, or old HIV medicines that didn't work well for that. Those are the kind of experimental drugs they're utilizing to help us treat coronavirus. And there's probably a lot of other things down the pipeline as we learn more about this virus that we can use to target this specifically. It's just like what Dr. Klein was saying, our science has moved very quickly in the last few months, given the spread of this virus, and we're still learning a lot about it.
Mhm.
And so that's going to continue to change and grow. I know one of the things that I've noticed is like information for us as medical professionals changes practically every day, in terms of the new science coming out, another news story, another way to help manage these patients, either in the outpatient setting or the inpatient setting. So the conversation that we're having may even look very different in a couple of months.
What's the difference between a therapeutic and a vaccine?
Therapeutic would be a way to treat the illness. A vaccine is a way to help prevent the illness.
So when people talk about new therapeutics, is that like, let's say if you got the flu and you got go and get some flu medicine at the drugstore, is that an example? So is it possible we get some kind of new Uber therapeutic to help against COVID-19?
Well, we've got 2 flu medicines that we use frequently right now, which are Tamiflu and Zofluza. Zofluza is actually a very new medication that we've had for the last year. Those are 2 ways that we can treat that virus. And hopefully, we have something down the pipeline to help treat coronavirus or COVID-19.
Mhm. Okay. Before we go to Dr. Klein to close us out with our little meditation session, questions come in on what can we be doing at home to support our healthcare workers?
Well, that's a wonderful question. Um, I, I've been really, really touched by people who are writing messages and putting Post-it notes up throughout the downtown medical center. I'm sure it's happening elsewhere. I walked into the hospital today, and people had taken colored chalk and written encouraging messages on the sidewalk. That's a really supportive thing and makes us feel like we're all in this together. Um, as far as practical things, besides just inspiring the people who are taking care of sick folks, I think making sure that you're not using protective equipment, the so-called PPEs. If you have access to surgical masks, please don't use them. Use a scarf, make a homemade cloth mask. Make sure that all of the PPEs that are available that are professional grade, go to the hospitals, go to the nursing homes, and things like that. We've seen some really nice examples in the research community because our research labs have N95 masks and they are being rounded up and sent over to the hospitals. So I think that's how people at home are helping out. And then just don't get sick. Do your very best with social distancing. That's probably the best thing you can do for the folks that are in the front lines is be serious about social distancing. Stay at home. Go out only to get your groceries or to get medicine or to get exercise in an area where you can be at least 6 feet away from the people around you while you're wearing your mask. That's what I would love to see people do.
Yeah, that's what everybody can do by being responsible and no house parties. Okay. Reports over the weekend that some people are throwing house parties, not a lot, but one's too many. Okay. Remember, as Dr. Moyer says, that the virus doesn't move, people move. Right? So the more you move, the more exposure you're probably going to get to the virus if you're close to people. So please just take that very seriously, kind of lock it down here for a while, and we're going to continue to get through it the way that we are relatively better than other cities right now. This is a tough week for a lot of people too because of the religious traditions that normally are taking place with Passover, Holy Week. People have a strong desire to be with families and their worship family as well, but we're not going to be able to do that. Okay, and it's like when you make an exception, that's what the virus is waiting for. Okay, because it's dastardly and it's just waiting for people to drop their guard. So we're going to have to conduct our faith traditions a little differently this year. So we're calling on everybody to remember that. No drive-through services here. Some people are saying, well, the governor is saying it's okay. Most of Kentucky is a very rural area. If in Louisville we had drive-through services on Sunday, we would literally have hundreds of thousands of people moving around the city at the same time. That is impossible for people not to interact with each other when that takes place, and that will lead to like a tinderbox for this virus to get moving again. So, it really gives me a heavy heart to say stuff like that in terms of having lockdown here during Passover and Easter week, but science is science, and we've got to really protect ourselves right now. So, Dr. Taylor, give us a couple closing thoughts, and then John will close with you with a 2-minute meditation. So, Dr. Taylor, any observations, concluding thoughts?
I would like to echo what Dr. Klein was talking about with the personal protective equipment, that if you do have anything that you have at home in terms of gowns or masks or goggles, we, as the Greater Louisville Medical Society, in partnership with the Metro Health Department, we are doing a PPE drive where you can call the health department, schedule a drop off, and the health department will help distribute those resources to multiple offices here in healthcare systems within our community that need it. So if you do have anything like that, feel free to reach out in that sense. And I think the other biggest important thing that we've been talking about, maintaining that social distancing, trying to stay healthy at home is going to be the most important things for us as we move forward in this COVID-19 pandemic. And I know, me personally, I would rather see you healthy at home than see you in the hospital. So please maintain that social distancing.
Well, thanks so much for joining us today. Will you join our 2-minute meditation here?
Be happy to. I just remind everybody.
I want to get Dr. Taylor first. Are you with us, Doc?
Oh, they're trying to make-
Oh, yeah.
Okay. All right. Dr. Klein, let's give it to you. You're a world-renowned meditator. One of the reasons why you're so healthy. You tell me when you want me to start the clock.
I'll give you a nod. I just want to mention to folks that we teach meditation to medical students because it helps them calm themselves and focus their attention to be better doctors. There's a lot of good science behind this meditation. This meditation is what we call a compassion or a loving kindness meditation that helps us deal with the stress around us and feel more love for everyone around us. So what I'd like everyone to do is go ahead and uncross their legs and just get very comfortable where you're sitting. You can close your eyes or you can go ahead and just lower your gaze and let's begin. And I I want everyone to think of themselves and how much stress they've been under for the last 3 to 4 weeks. And I want you to say to yourself, may I be safe, may I be happy, may I be healthy, may I live with ease. And say that one more time. May I be safe, may I be happy, may I be healthy, may I live with ease. And then I want you to think of a loved one. And it doesn't have to even be a person, it can be your pet, but someone who makes you or something that makes you smile. And I want you to think about them. And while thinking about them, I want you to say, may you be safe, may you be happy, may you be healthy, may you live with ease. And now I want you to visualize someone that you don't really know, but you see every day. Maybe it's the person who checks you out at the grocery store. Maybe it's a policeman or the person who checks your water meter, or someone who works for MSD or a fireman. I want you to visualize that person and say to yourself, may you be safe, may you be happy, may you be healthy, may you live with ease. And now step back and think that you can sort of see from way up above the whole city, all of us. And thinking of all of us together, say, may you all be safe, may you all be happy, may you all be healthy, and may you all live with ease.
Well done, Dr. Klein.
Thank you, sir.
Encourage everybody to take a few minutes and do some breathing and go through questions like that and slow things down. Love yourself before you can love others, and we got to have our own health. If we don't have our own health, we can't do anything. So let's all keep working together. I want to thank Dr. Taylor and Dr. Klein for helping us each and every day as healthcare professionals, and particularly as we work through this time, which we will all get through. So thanks everybody for watching here today. Thanks again to our resources. Everybody take care of themselves. Be safe. We'll be talking to you soon.